This is a kind of tricky question, but it's very high yield for step 1. So, a 30-year-old man. Okay, so it's a woman. I can't look into the camera and read the question at the same time, so bear with me. Okay, yeah, woman develops a fever, rash, and joint pain 9 days after starting rituximab for rheumatoid arthritis. Biopsy shows a small vessel vasculitis with neutrophil infiltration. What labs do you expect to see? If you're taking monoclonal antibodies, like infliximab, rituximab, then you gotta know that this can induce what's called a serum sickness reaction. This is a type 3 hypersensitivity reaction, and this is triggered by immune complex deposition and also your complement activation. And so this question's getting at, hey, which one of these is associated with the complement system? Which one is activated and used up? And so our answer is going to be decreased C3 levels, because that's part of our complement system, right? It's going to lead to hypocomplementemia. Hypocomplementemia. That's a really fun word. Especially your low C4 and your C3s. They're going to be low. Yeah, but why not positive Candida test? Candida is going to be type 4 hypersensitivity reaction. What about elevated IgE? It's going to be a type 1 hypersensitivity. There you should think of like anaphylaxis or maybe asthma as well. What about elevated serum IgA? For that, you should think of HSP. It's not going to be a serum sickness. What about neutrophilia? So neutrophils can marginate to the tissue, and if they marginate to the tissue, then you can see neutropenia, not neutrophilia. And severe thrombocytopenia, yeah, you could see some thrombocytopenia, but it'd be mild, not extremely severe. So here are the key factors to look out for. Monoclonal antibodies, infliximab, they're going to provoke immune responses 7 to 14 days afterwards. Now, if this was at all confusing, I want to show you this website I built. You can just click here, boom, hypersensitivity reactions, and look at this guide that I made. It tells you the timeline for each one, how immediate works. Here's how type 2 works, and then here's how type 3 works. Here's the delayed type 4. Here are all the mnemonics that you need to remember this. Here's a nice chart so you can see all the information. Here's some high yield pearls, the most important parts. I'll zoom in so you can kind of see here. So you can see there are some mnemonics to remember the timing, the serum transfer, some buzzwords. Wheat and flare for type 1, hemolytic anemia type 2, granular immunofluorescence type 3. Guys, this goes on and on. I'm building an entire database of the most high yield content about every single condition. And if you're about that, please like and subscribe. Right now, I'm doing this all just for free for funsies, but I'm doing this because I believe in the power of free education. It is insane how much that all these prep companies are charging us. And I'm doing this to try to lower the prices and get this high yield information in the hands of our future physicians. Please consider liking and subscribing if you at all found this helpful. We'll see you in the next video.